everyone. On this episode of Coding with Kate, I wanted to talk about why I'm leaning towards working in the clinical registries versus medical coding. I've had time to really analyze why I'm leaning that way, what my thoughts are on it, and then also because as I tell people this is the direction I'm going, they ask, why are you giving up coding? What do registrars do? All of that. So with all of those discussions and my analysis, this is what I've come up with. And I think it might be helpful for medical coding students or students that are in the health information management programs that want to learn more. I don't know how much of the registries come up in any of that, and I know for sure in medical coding, at least with a program I took through HEMA, they did not bring up registries at all. So I think this might be really good information just as another resource and to give another avenue that uses the same skills that you learned in a coding program, but in a slightly different way. So as I look at the differences between medical coding and registries, I am beginning to see more that medical coding and coders have the one and only motivation of money, finance, reimbursement. That's their motivation for coding. They code so that the healthcare facility gets a higher reimbursement on the services that they provide. So they are only thinking about the money, what's going to get them the biggest return, and that's about it. And yes, when I started the coding program, I knew that the codes that I apply translate into charges, which then translate into what the hospital will be reimbursed from the insurance company or what the patient will pay out of pocket. I knew that, but it didn't really sink in and I didn't really think about it as I was learning. I was trying to learn everything there is to learn about the code books, the processes of coding, how to use them, how to look at a medical document and figure out what code should be assigned based on what is in that medical record. I didn't think about the billing aspect, how much the hospital will be reimbursed based on what codes I sign and in what order. I didn't think about that. That wasn't anything I was interested in. I solely wanted to look through the medical record and use the code books and assign codes that give a clear picture of what the diagnosis is and what the procedure was that happened or what service took place in that encounter. But once I started learning about registry work, and as I'm learning about the registries and also what I infer based on what I know and what I don't know, registries' sole motivation is tracking and documenting all of the data about the diagnosis and the procedures that took place that can be used for further research, quality improvement, performance improvement, innovations in treatment. Their sole motivation is on the data, tracking the data to use for improvement of the treatment and what they know about the medical treatments and medical diagnoses of patients that come into the hospital. That's essentially what I believe or what I infer registrars do and their importance and their motivation, and I prefer that over money, billing, finance, etc. So that's also why I'm leaning towards registries, because they could care less about the billing, they could care less about the charges, how much money the hospital is going to get back. That does not influence what codes they assign or what they are tracking. Doesn't influence it, they don't care about it, they want the clearest picture possible of what the patient came in with, how they were treated, and how all of that information can be used to further medical treatments in the future for other patients with a similar diagnosis or similar treatments. I like that over billing, money, reimbursement. So that is why I'm moving towards registry work, because I like where the motivation is and the reason for the work that they do versus medical coding. And I wish more academic programs or just courses in general talk about registry work, because before coming across that clinical data registry position over the summer, before I came across that, I had no idea registries existed. Had no idea. Never thought they existed, had no idea what they did. It was as if they were never there. And once I found out about them, more things that we do in coding make more sense. And some questions were then answered. One specifically was when I was going over external cause codes, injury codes, that stuff. I didn't understand the rationale behind why medical coders aren't required to assign external cause codes and injury codes. I had no idea why they were not required. I thought, you want the clearest picture of what happened, so wouldn't this information be important? Wouldn't you want to know that it's a gunshot wound that caused this injury, or they were riding a bike and they fell over? Isn't that important information to give that clear picture of why this diagnosis was assigned? But now I see that external cause codes, injury codes, they have no influence over the reimbursement rate. They don't have charges assigned to them. They don't sway how much the charge should be for the service. So there's no reason for a medical coder to assign them. And it isn't, I'm inferring, isn't required because not all hospitals have a trauma designation. So they don't need to track any trauma cases that come in. So it isn't pertinent information for them because they aren't tracking that data. But for hospitals that do have a trauma designation, that are a trauma center, they need to track that data so they can get all of that information about what types of traumas are happening in this geographical area, etc., how they were treated, what were the outcomes, were there any comorbidities that happened after the patient arrived at the hospital, etc. So having all of that information about what occasioned that visit, why did they come to the hospital, that is information that is needed in the trauma databases in the state, locally, nationally, etc. But they never brought that up in any of the coding courses. No one ever explained this is why it isn't required for medical coders. I would have liked to know the reason. And I think it would help a lot of other medical coders to know that reason so they can understand and at least explain why external cause codes aren't required in all hospitals, meaning medical coders aren't required to assign them. That would be really good information, and it might help these new coders understand the structure of health information management, all the different departments that are involved, and how all this information is used, instead of just having tunnel vision on just medical coding and not caring what else is happening and what other departments use the information that they are coding. So that is my reasoning for preferring registry work over medical coding, what I've learned about it, how all these pieces fit together, and hopefully in the future, while I continue this journey through registry work, learning about cancer and trauma registry, and filling in the gaps of what I didn't understand through medical coding that I now understand through registry work, I think having this as a resource may be very helpful for new coders, because it may give them a different idea of what career path they'd like to take. Because like me, they may have never known registries exist, and the closest they could get to doing the work they like is medical coding, but to get them even closer to what they want to do could be registry work. And having that resource there to explain this exists, this is what they do, it might help medical coders define what their career path should be, what they want it to be, and give them that access to that information and a way to learn more and then get into that career path if it's what they want. So hopefully that was helpful, and keep an eye on all of the upcoming videos because I may have a lot more talking about registries, what they do, the tools they use, processes that they go through, etc. So if that is something you're interested in or want to learn about, stay tuned for that. So also subscribe to this channel so you can get those notifications and all of those videos that I post so you're always in the know. Also comment below if you have had experience in registries or you've heard about registries or you have questions about it that I can hopefully find the answer or I can hopefully answer in future videos. Let me know. And also like this video if you like the direction that we're going in, and then also the information and the reasoning behind me going more towards registry work instead of coding. Hit that like button if you enjoyed learning about all of that. And I will see y'all later. Bye!